Zen Chu. I'm a biomedical engineer and faculty director for our HST Health Science Technology 978 Healthcare Ventures graduate course, as well as the Hacking Medicine Initiative. This is the most exciting time in the history of medicine. We've got so many tectonic shifts across payments and healthcare reform and insurance and new technologies, and we get to teach the next generation of physicians and entrepreneurs and scientists how technology scales medicine. The reason that this is the most exciting time in the history of medicine is that we have, the simultaneous trends of, supercomputers in your pocket that have all kinds of sensors. We've got electronic health records that for the first time digitize the information for doctors and, more importantly, computers and artificial intelligence to help patients and scale amid doctor shortages and an epidemic burnout of healthcare professionals. So it's really all of it together, as well as technology venture capital firms realizing the huge opportunity in healthcare startups. The latest company that I'm excited about, and we've had dozens of companies come through, but I can't work closely with all of them, but a handful of them I serve on the board and serve as a first investor or among the first investors. And the latest company was started 5 years ago, called Abridge, and they are using artificial intelligence and large language models to give doctors and patients a recording of their healthcare interactions and help make actionable all of the things that come out of that sacred conversation between doctor and patient. So next appointments, dosage changes, medication changes, new prescriptions. It's doing all of that automated and at scale now that they are in multiple health systems and have over 1 million patients using their system. And thousands of doctors. We're saving doctors 2 hours a day at scale amid an epidemic of healthcare professional burnout. So hospitals are clamoring for this, and their revenues are going through the roof because of the desperate nature of these hospitals and physicians. By using artificial intelligence and machine learning and large language models, but not GPT-3 and all of that's being hyped over the last year, because you can't use that for healthcare because of the hallucinations, because of the patient privacy. This company started 5 years ago with a visionary cardiologist, Dr. Shiv Rao, and he created this system to transcribe those conversations, give that to the patients so that they can understand it. Because if you get a new cancer diagnosis, on average, studies have shown that those patients forget 80% of what the doctor says, right? Because of the stress of that new diagnosis. And they, can't share that with their spouse or their adult children or their primary care physician. And so this records it, transcribes it, and then automates a lot of the administrative burden on behalf of the doctors to take action and put this in their medical record. And so Abridge is the only other company at this point, alongside Microsoft, to be on the Epic platform, which is the dominant healthcare record platform in the US.